Hi, my name's Dr. Ross Hauser. You're here at Caring Medical, Florida. I just met a new patient and I was examining the patient's, I was doing a straight leg raise test for his lower back pain, and I noticed the clicking in his knee. Uh, you'll see when we move the camera around this way that he's had a knee replacement. And it's very common, we're finding in the office here, that people with knee replacements end up with knee instability. And I believe that's the cause of why 1/3 of patients after a knee replacement still have chronic knee pain. So we're going to show his high resolution ultrasound scan, and you're going to see me just moving his knee like that, just a little bit like that. So we'll now move the camera around. We can see from the ultrasound scan this is a knee replacement. That's the hyperechoic area here, the reflection from the knee replacement. And we're going to look right here. We're going to see what happens right there when I stress the joint. See how it opens up. See how it's opening up right there. So obviously the treatment for that laxity is going to be prolotherapy. Prolotherapy is very successful for people who've had a knee replacement who still have pain. It tightens the actual joint because the pain after a knee replacement is almost always from joint instability. So anybody with pain after knee replacement, I'd really encourage them to get prolotherapy.